Typically, this age group is always sort of the last to get evaluated for a new vaccine, a new medication, et cetera. And the primary rationale is for safety reasons. So typically with any new vaccine or any new medication, it's first tested in adults, and then it goes through an age de-escalation strategy where once it's shown to be safe in adults, then it will be tested in younger people and then older children, followed by younger children. And then finally, the youngest children are usually sort of the last group that will be evaluated. And so that general approach still held true during the evaluation period for COVID-19 vaccines. Now, it is true that there were some delays in terms of the timeline for when vaccines for this age group actually did finally receive their authorization. Part of the challenge was that initially the first vaccine candidate that was potentially eligible for authorization was the Pfizer version of the vaccine. And initially, they tested it as a 2-dose series, the same way it was used in older children and adults. But what they found was that in this age group, 2 doses didn't make a strong enough antibody response. And therefore, they had to add the 3rd dose to ensure that the vaccines would be able to produce the desired antibody response and thereby provide protection. So that actually extended the timeline somewhat for the Pfizer vaccine. Similarly for Moderna, the Moderna version was always a little bit behind Pfizer to begin with for the pediatric trials. And for the Moderna vaccines, earlier on, it was noted that the risk for myocarditis with the Moderna vaccine did appear to be slightly higher than with the other vaccine types. So because of that, there was extra attention being paid for the Moderna vaccine when it comes to pediatric ages, so 17 years all the way down to 6 months. So for that reason, the Moderna evaluation for all of those age groups took longer than for Pfizer. Now, it's been a long road for parents who have children in this age group. So I just want to say congratulations, you all made it to the finish line and they're now authorized. We have options for our youngest children. And so I certainly would encourage anybody out there who has children this age and wants to protect them from severe COVID, that we finally have vaccines, and I would not hesitate at all to have your children vaccinated.